1460 WVOX.
Now, live from Whitney Media, 1460 WVOX, the Greenburgh Report, with Greenburgh Town Supervisor Paul Feiner. You can join in the conversation at 914-636-0110. Now on 1460 WVOX, here's Greenburgh Town Supervisor Paul Feiner.
Hi, I'm Paul Feiner. I'm the Greenburgh Town Supervisor, and today we have a very important program, and we're going to be discussing what could be done to help young people overcome some of the mental health challenges that they face. I first learned about Innovative Health Systems. It's an organization based in White Plains in the 1980s when I was a Westchester County legislator, and I met Dr. Ross Fishman, a resident of Greenburgh, who's very involved in the community. Dr. Fishman started Innovative Health Systems, and he has been very instrumental in making a world of a difference in children's lives, helping them get on track. Ross has retired, and Abe Hikind is now the president and CEO of Innovative Health Systems, and Deborah Flynn-Capalbo is chief clinical officer. And they're my guests on today's program with Pauline Mosley, who's on the phone. So I just wanted to start by asking you if you could tell us a little bit about Innovative Health Systems.
Well, thank you. Good morning. Good morning, Paul and Pauline. Thank you so much for having us this morning. Innovative Health Systems, as you mentioned, is the product of Dr. Ross Fishman, PhD, who started the organization back in 1985, and built it up to what it is today. Innovative Health Systems was the first of its kind as an outpatient facility, and then became and has really had milestones unique to White Plains specifically, with being one of the first to offer buprenorphine as an MAT program, and in 2019, Dr. Fishman and I joined heads, and he transitioned the company to me. During that time, Innovative Health Systems has come a long way. We offer an outpatient and day rehab program for adults from the ages of 18 and on, all the way to 99, and we offer services specific to women's only groups. We offer Spanish-speaking tracks. We have an outpatient clinic that is specific to one-on-one sessions with our counselors. We have a day rehab program. We have groups throughout the day. And Innovative Health is constantly evolving. We're all about the patients and the community. We recently just launched an anger management program for patients, domestic violence program. We have a tremendous contingent of LGBTQ IQA services for our patients. And something that we launched, brought back, was an adolescent program as well. Adolescents for the ages of 16 to 19 it started, and then we rolled it out to the ages of 11 to 15. And it's just evolving. We've seen a tremendous growth on the Spanish-speaking track, and really we cater to every patient and their needs. Innovative Health, like the pandemic, unfortunately, of addiction, does not discriminate. We see each patient individually for whom they are and what their needs are. And any patient that comes to Innovative Health, be it through a call, through a walk-in, which is something that we offer as well, we will help them in any way we can through our facility or relationships we have with other facilities as well. And really, it's a credit to our Chief Clinical and Health Officer, Deborah Flynn-Capalbo, who's here today as well, who will be able to, provide even greater depth of explanation as to what we do and why we do it, and whom we cater to. So, Deborah, it's great to have you here with us today as well. Really, the anchor of Innovative Health.
I just had a question. I read about the young woman who had committed suicide because she was billing. Is that the type of problems that we see here in in Westchester, and would your organization have been able to help somebody like her?
Yes, definitely. School violence has increased greatly. A lot of it has to do with the post-COVID kids returning to school. Kids have not been really socially active. Everything's been through a text and everything. School violence is one of the biggest things that the kids are facing today besides school anxiety and school phobia. Bullying is a very big thing, and though the schools may have a no tolerance policy, many times it's not able to be followed. Often kids don't come forward. Developmentally, we know that's correct. They're afraid to come forward. They don't want to tell their parents or anything. But being bullied in school is so detrimental to kids. It takes away their self-esteem, who they are. And the problem with this school bullying is we now have social media. So when you're bullied and it's posted, it's like a train wreck. You're watching it and watching it and watching it all the time.
We have to take a break, and then we'll be right back. Innovative Health Systems is located at 20 Church Street in White Plains, and their phone number is 683-8050, and we'll be right back right after this break.
WVOX. Now back to the Greenburgh Report on 1460 WVOX. Once again, here's Greenburgh Town Supervisor Paul Feiner.
Hi, I'm Paul Feiner, Greenburgh Town Supervisor with Pauline Mosley, my co-host. And Pauline, do you have any questions?
Yes. Good morning. First, I want to thank both of you for the fabulous work that you're doing with your company and offering alcohol and abuse treatments for residents of Westchester County. So thank you so much. Just before the break, Deborah, you were talking about cyberbullying, and my question was, does your organization work with schools or universities offering substance abuse awareness, or with social workers that are within these educational settings?
Lately, we've been actually connecting to student assistance services. They've been making referrals. So we are doing that. I also teach, and I know you do too, at Pace in Westchester. So I go over that a lot with the classes. And I think we really need to start that much earlier in life, because we've lost a lot of funding for mental health. So early intervention, social emotional growth, and all the things that come with that would be sort of a solution to some of this stuff. But we've been, the White Plains schools we've been talking to. I have students in my class from the Greenburgh schools. We're talking to getting into the Greenburgh school system also. So I think that is the way to do it. You know, I really feel like, I think the administration really needs to know, because mental health is so impacted by bullying. And I think that we're not seeing that, how often that kids who are impacted with depression and anxiety comes from a lot of school bullying. So I do think starting at the kind of grassroots and starting with the kids in the school is great. So we've made a lot of connections. So we've been working more to cultivate that. We have a lot of kids coming in now. We have walk-ins, which has been a great help to some of the kids who just want to come in and get some information, or their parents call. So we are trying to partner with a lot of different facilities.
In terms of the schools, many schools have their own counselors. Why should people be, what could you offer that the schools don't offer?
The problem is with the schools, mental health has been cut, the funding's cut. So, and they're not able to be seen as they need. And the councils will say that, we can't get to everybody that needs it, because the number of people who need it, the kids who need it, has grown exponentially. And
we're obviously having a lot of problems all over the nation. Also, the issue of gun violence in the schools, is that something that your organization can help with? Obviously, you can't guarantee anything, but do you feel you could help young people who are struggling emotionally?
Definitely, I think so too. I teach school violence for the state, and I believe that to me has been a passion, because bringing it to school and you're so vulnerable, and these kids are very anxious in school today. Between the drug epidemic, all the things that are going on, these kids are so fearful of sometimes coming to school. They rather be remote, and they're fearful of when they get into school, what's going to happen to them. So I definitely think that we can be a support to them. I think we have enough training. We have social workers. We have mental health counselors. We have KSACs. I think that with the adolescent program, the people that are assigned to it are particularly aware and trained with working with adolescents. That's the key. If you want to work with adolescents, that's great. But if you can work with adolescents and do a good job, that's where you're going to make the difference. And I think we're just an adjunct to add on to many of the schools. They're thankful that there is somebody out there.
When you deal with adolescents, are we talking about a very small percentage of adolescents who have mental health issues, or is this much more widespread than a lot of people think?
We underestimate so much how widespread it is. Depression, anxiety, that's why a lot of the kids are turning to substances and alcohol, because they're self-medicating. They're starting at 12, 13, 14. The vaping continues consistently, and these kids are not then able to sleep. Okay, I'm going to vape. I'm afraid to go to school. I'm just going to take a few hits before you go. So I think that the conflict we have in this country is that the comorbidity of the mental health and the substance abuse, we're not getting the severity of it. And I feel like, and parents, and mental health is still a stigma. We all realize that. So if you can stop some of the mental health and treat that, we use mindfulness, CBT, DBT, but we use what works. Sometimes the patients just talk. Kids like to just talk sometimes. And when they feel comfortable, they really share what's going on. Then when they tell us what's going on in the school, we'll contact the school and let them know that what is really going on. So I feel that we're underestimating the amount of mental health that we are facing in today's country.
Pauline, do you have another question?
Yes, I do. I think this is such an important problem that is occurring or on the rise since the pandemic. And I wanted to know if either of you, as experts, could share with our listening audience and parents and guardians and caregivers, what are some of the signs that we should be looking for? As we know, our youth are coming out of the pandemic, social ills that are happening in our world today. What are some of the signs that could help us as parents or guardians or caregivers if we see not just our child, but our loved one or our spouse that might need some help in terms of mental illness or in terms of substance abuse? What are some of the key signs that, and if so, we could then come to your organization for some help?
Well, as a family or a support person, you're going to see more anger out of a person sometimes if they're using. Mood changes. They're very labile. They're not sleeping. They may have lost weight. They can be very quick-tempered in the family. Domestic violence then starts in the family. Abusing children. People are short-tempered. When things are missing in the house, people are selling things to often buy it. You can sort of look at the person and they become a shell of a person. They don't look like the same person you had before. You can't put your finger on it, people will say. But you'll notice the telltale signs. Their appetite may change. Their patterns of sleeping may change greatly, but their personalities change. And that's one of the biggest things. That's when if you have a slight suspicion and you see all of these things have changed, the dynamics of the family, it's time just to get someone to have an assessment. Is it easy? It's not. People don't want to have an assessment because they don't want to believe that there's something wrong with them. But even alcoholics, people out of the blue are arrested for a DWI or a DUI, and everyone said we didn't see any signs. Unfortunately, you have to check rooms, you have to check drawers, you have to check common spaces, because it's better to save a life than to have somebody, run somebody down. So I think that when you see something out of the norm, say something, because it could be very subtle, or it could be, too late when somebody's, beating their spouse through the, with the children in place and the kids are reporting things to CPS, that goes to school.
Yeah, we have to take another break, and my guest is Hikind and Deborah Flynn-Capalbo of Innovative Health Systems, 20 Church Street in White Plains, telephone 683-8050. I'm Paul Feiner, Greenburgh Town Supervisor with Pauline Mosley. We'll be right back.
I'm sure you.
Now, back to the Greenburgh Report on 1460 WVOX. Once again, here's Greenburgh Town Supervisor Paul Feiner.
Hi, I'm Paul Feiner with Pauline Mosley, and we're talking about innovative health systems, behavioral. They're an organization that helps people with behavioral issues, and we were talking about some of the issues impacting young people, but your organization also offers programs for adolescents. And could you tell us about some of the behavioral problems that adolescents have?
Definitely. We separated our program into two age groups, which was developmentally appropriate. Many of the kids are coming in just from the schools. They're vaping, they're using marijuana. Kids sometimes share pills. That's a big thing with the kids, too. We are underestimating how many people are just getting pills from their homes. And the selling of drugs in school is awful. So we have the kid who's now been bullied or has peer pressure to use and continue. There's people that are coming, adolescents that are impacted by somebody in their family using. You know, a parent may be using, a sibling may be using, and we don't realize how much damage is done and continues to be done if we don't get that child in.
If somebody's being bullied, is it something that could also be from, are they getting it from their parents also? Is it sort of like a hereditary?
Yes. Alcoholism is hereditary. A lot of the mental health issues are hereditary. So you combine people that have mental health problems, schizophrenia, depression, anxiety. All these things are coming down. ADHD. Many of the kids use medications because their parents might often not agree with medication. It's a personal choice. But they're self-medicating because they don't feel well. They are using because they want to fit in. Kids have to fit in as adolescents. And today we see more cliques. We see the violence and everything, and kids just want to be accepted. They're afraid to go to school. So I think that's what we've been dealing with the kids who come in. They don't tell their parents the truth. They don't always tell us the truth, so it takes a while to get the rapport going. I think that working with adolescents, to me, is the most important thing.
In terms of, bullying, what percent of, say, kids get bullied, would you think?
I'd say the statistics now are saying more than 1 in 5. And I did read lately that there was 40% of kids that are bullied at a point in their lives. And bullying is not just a one-time thing. Bullying is just pervasive. It's returning. It's like you're waiting for the train wreck to come, and you're waiting every day to have this happen to you. And you imagine having something like that in your life, and imagine a kid whose brain is not able to process it, going to school, every class looking outside to see when the bullying's going to start. So, of course, they're going to be depressed. They're going to be anxious. There's too many kids who have thought of suicide. And parents don't always recognize it. And kids do not always speak to their parents. Parents have to watch and really listen to what they say. And listen just to what's bothering them. So I think that's a gap, and we have to train parents. I think parents need to be trained to do it.
Pauline, do you have another question?
Yes, I do, Paul. I wanted to know, in addition to innovative health services providing services for treatment, do you also provide legal support? Because there's some of these drug substance abuse disorders, for instance, like DWI, that have another layer of complexity because they're dealing with the law. And I want to know, do you provide some support on how to deal with the legal system and also how to help these individuals not be in this, lifestyle again, and how to prevent them from not being entangled with the law?
We do. We've had for years a very successful DWI group. So we have it in English and in Spanish. So that's something that we do. We talk to the courts. We talk to parole. We talk to probation. We talk to task providers all the time. We have a SERPA, which is someone who can reach out and help someone, can access services for them. So it kind of is wraparound services, because a big portion of the people that come do have DWI, and they'll also come for individual sessions too. So that's very important to really make it, and sort of make a peer group that they're having is going to be the best thing for them. Then they have their individuals, which just tightens the skills. They need to use coping skills. There's so much stuff. You know, that's where you pull in the mindfulness, the DBT, the CBT. You need to use all of those skills and give them the skills to find better coping skills than to use when something happens. So we've been doing that for a while, and it's pretty full. Both groups have been very full.
How many employees do you have, and how many patients do you serve?
So Innovative Health Systems currently has approximately 20 staff that comprises of mental health counselors. We have social workers, CASEX, CASEC 2s. We have trauma specialists. We have psychiatric nurse practitioners. We have our medical provider. We have family practitioners. And we have, throughout our program, and as Deb mentioned, we have many of our programs we have a Spanish-speaking track for, and we have personnel throughout that are Spanish-speaking as well. We have seen a tremendous uptick on the Spanish-speaking track as well, and it's why we want to give those patients as well a positive experience throughout, from our front office staff all the way to our medical team. And we're tremendously focused on the psychiatric side as well. We believe that a lot of it, that substance abuse and alcohol is intertwined with mental health, and all of our patients get psychiatric evaluations, and that's why we're bringing in more staff to do that as well. So, and
I just want to give a shout out to Dr. Ross Fishman, who's a leader in the Greenburgh Police Community Advisory Board, and I've known Dr. Fishman for many years, and it's really amazing that somebody who is as modest as he is and humble as he is started an organization that really does such amazing work, and really has helped so many people overcome challenges in their lives. Have you have you worked with local police? A lot of the local police departments, or do you have contracts with police? We have youth officers all over.
Right. We do. We work with the police. We actually are trying to start having the police, when they pick someone who could be a potential client up, a person who's been out of control, who's, obviously has been intoxicated, who they're using substances, they go to an ER. We will take them from the ER. We'll do an assessment. Oftentimes, people need a higher level of care. They might need inpatient. So once we take them in to do the assessment, we are responsible, because they're in our facility. We need to get them placed inpatient.
What about the courts? Do any judges refer people to your organization?
Yeah, they do. We work with drug court. We work with mental health court, parole, probation, and task. So we have a good rapport. We've had a good rapport with them for a while. So actually, Abe's building out a lot more space and growing.
Innovative Health is actually taking on additional space now as we speak, because we want to have the ability to service both our adolescents and our adult programs. We're seeing an increase. Our patient body is unfortunately growing, and we want to be able to service both our adolescents and our adults at the same time. The fact is that we have to be very understanding and cautious with regard to our adolescents, not to be able to have them. You can't really have them there at the same time as the adults. Having another floor, having another additional space will be able to give us that opportunity to simultaneously run those groups as well as larger groups to have community outreach. And as Deb mentioned, we've been working with the drug court for some time. I know Dr. Fishman has been involved in many different things and was very influential with the drug courts when they started the program many years ago. But we have a constant rapport with all of the mandating facilities. We'll work with them. At the end of the day, we're patient focused, and it's about the patients, and it's what we've seen as why we've gotten such support is because they welcome facilities that have that same focus that Innovative Health does.
Do you get any government funding?
Innovative Health Systems is a for-profit organization, and so we do not. But we are really all about the patients, not about, for us, as a for-profit, we focus on the quality of care and not on the quantity of care. And I've seen, and that when you have that focus, it allows you to really, the approach is a lot more sincere, and the results are greater because it's the underlying foundation of the success that a facility like Innovative Health requires to be able to help their patients.
Pauline, do you have another question?
Yes, I do, Paul. I wanted to know, could you share with our listening audience the successes that you have had, or what if you have any data on how many either adolescents or adults have recovered or reclaimed their quality of life after receiving your services and working with your therapist?
Well, that's a good question, and
we have to take a break, so we'll have to answer that question right after the break. And I want to advise our listeners that Innovative Health Systems, they're located at 20 Church Street in White Plains. Their phone number is 683-8050. And if you know anyone who has behavioral issues, you might want to refer them. And I guess you take all the insurance?
Yes, Innovative Health accepts all insurances except Medicare. And we do have a sliding scale and a discounted program for those that can't afford as well, that need to pay out of pocket. We are all about the patients, understanding their needs, and we will work with anyone that comes our way.
Great. So we have to take one final break, and then we'll be right back, and then you can answer Pauline's question.
1460 WVOX.
Now back to the Greenburgh Report on 1460 WVOX. Once again, here's Greenburgh Town Supervisor Paul Feiner.
Hi, this is Paul Feiner, and before we go to Ross Fishman, who's on the air, would you be able to answer the previous question from Pauline?
Yes. So the fact is, Pauline, as far as I think your question was in regards to percentage of patients that complete that see success, and am I correct on that question that you had?
Correct. Some success rates or successful testimonials you might have to share with our audience.
Well, the reality is that in regards to success, so addiction is a disease, and we help all in this industry. Facilities help patients to cope with it and get better to where they're functional. But Innovative Health is a facility that we care about all of our patients, and we maintain that relationship throughout. So all of our patients, in some form or another, always, have a story, and all of our patients are always going to have Innovative Health as part of that story to maintain and ensure that that they remain on track. And the fact is that sometimes things happen, and Innovative is always there to help those patients pick them up. So many patients, we have large percentages of patients that will say, have lesser levels of care, but they will always be involved because it's always a part of them. And Innovative Health is always going to be there, even if it's just a phone call to talk to the patients. Innovative Health will be there to come in. Patients, just our staff is always checking in with their patients, past and present, just to make sure that they're okay. So a patient never really leaves Innovative Health. They just change the level of care to where they are now in a maintenance mode, and we will always be part.
I want to hear from Dr. Ross Fishman, who founded Innovative Health Systems, and Dr. Fishman's been very involved in Greenburgh in our police advisory committee. And Dr. Fishman, why did you form Innovative Health Systems, and how has behavioral issues changed since the 1980s?
Well, thank you, Paul. It's nice to be with all of you. I came in a little bit late, but I've heard most of the program, which has been excellent. I would say that since 1986, when we started, Innovative has made major inroads in dealing with substance abuse disorders in our community. And when Abe took over, he's taken it to a new level and expanded it more than I had ever imagined. We do know that the heroin problem, the fentanyl problem, has certainly gotten out of hand. It was serious 10 years ago, and it's even worse now. I think you've had an excellent program this morning. It was very nice to hear my colleagues expand on the program. I think they've covered everything quite well. And thank you for mentioning, I feel I'm a liaison between Innovative Health Systems and the Greenburgh community, because I am on the Police Community Advisory Commission, which I've been on for many years and headed it at one time.
Well, you've done a tremendous amount of positive things for the community, and you have changed lives for the better. And I think Innovative Health Systems really is a type of organization that could really make a difference. Even if you change one life, it's worth it. But you've changed many, other lives. You also have an anger management program, and could you tell us a little bit about that?
The anger management is a much-needed program. We do have patients who have been incarcerated. We've had patients with domestic violence charges. We do find that they go hand in hand, anger management, and who in this world couldn't use some coping techniques for their anger. It's a tougher world than it's ever been before. So it's being led by one of our male clinicians, and we're going to be putting in one for the females also. We're not sure if it's going to be co-ed or not. But the anger management stems from their anger at them using drugs, their anger at them for the choices they've made at life. They're angry. So what's going on in that program is to address the needs of everybody. We get a history of who's going into the group and everything, and we curtail it to everybody who's been in there. So I think anger management is much needed throughout our country, a lot more than it's given. So we're proud of that one.
Yeah, I had another question that I just thought of. A lot of parents, they learn that their kids suffer from addiction, and do they need special counseling?
Definitely. That is one thing. We encourage family sessions. It doesn't always work at the first few weeks with the child. The child's not comfortable speaking in front of the family, but the parents don't know what to do about it. And it's not my child. It's a stigma to them in their heads and everything, and they want it fixed overnight. So we carefully have to meet with the parents. We do assessments if it's a minor, with the parent present. So at the end, we see if we get a family history or a good psychosocial, that's how we help everybody in the family. We get it from the parents, we get it from the children, we get it from the school, but parents need a lot of support. So we feel like that, giving that support to them. We have a women's support, men's support group there. So we have support groups not for only the people who are using, but the children of these people. We're getting them in younger and younger.
And do the parents level with you? Is it hard sometimes to get them to admit what's going on?
No, they don't, because some of it is cultural, some of it is what's going on in the house. Some of it they realize if they told us everything, there might be a call made to CPS or something. So we can't force people, but when they build a rapport with us, they're more apt to tell us, and they realize they have to do it for the good of their children.
And that's why when Abe was talking that sometimes you have the continuing programs, because it may take time to really get the full benefits.
Right.
No, absolutely. And the fact is that, it's a challenge in any family. It's a challenge in any individual. Nobody wants to recognize that they need help, and that's probably the biggest challenge. And for families, it's a stigma just of recognizing that a loved one, be it a child, be it a family member, needs help. In Innovative Health, really, we meet you where you're at, and we have every single type of tool to help our patients. But the fundamental one that we believe is not the popular, is the obvious one, but no one talks about, is the simplest one, and it's listening. We offer our parents and our patients someone to listen to, because most of them just want to be heard. Our adolescents especially, but our adults and our parents, and really we feel that the fundamental technique for any facility should be listening, because it's how you get through and gain the trust of your patients.
You treat some patients with medication. Do some organizations or doctors over-treat with medication, and could people be treated without medication?
Many people can come in. Their addiction, they're managing as it is, but there's so many new medications out there now. We have Sublocade for opioids. We have Vivitrol, which we could use for opioids or alcohol. There's Suboxone. There's so many new things. So if it's the really more dangerous drugs, those are the ones that have to be maintained on some kind of it's a medication-assisted treatment. It's a MAT. But we don't encourage everyone. People have some psych meds that are done there too, because we have psych nurse practitioners. We have our medical director. We have medical nurse practitioners. So at this point, I don't find that we overdo it all. We question it. We take a good history and physical to make sure that people are telling us the truth about their history and physical. We require that. We have different tools to go on to make sure that they're not drug shopping, going to different places. So we're very cautious, I will say. The one thing, the medical team is very cautious with the medications there. Great.
Well, we're running out of time, and I just want to thank Abe Hikind, President and CEO of Innovative Health Systems, and Deborah Flynn-Capalbo, Chief Clinical Officer, for your efforts. And I want to thank Dr. Ross Fishman for starting this very important program. And as I mentioned, Ross has done a tremendous amount of good work for the town, and we appreciate him. And he's so modest and has done so much without bragging. A lot of people who brag don't accomplish as much as people who don't brag. And he's somebody who's underestimated as to his impact on our community.
He's
Absolutely.
the gentle giant. He's
Definitely.
our gentle giant.
Thank you, Paul. That was very kind of you.
Well,
thank
that's
you
true.
for us today.
And thank you, Paul and Pauline, for having us. Listen, the fact is that this was Dr. Fish. We've continued Dr. Fishman's legacy, and Innovative Health is here.